Hello, my name is Keith Pratz. I will be reviewing the report of the combination of Venetoclax with decitabine or azacitidine in treatment-naive patients with acute myeloid leukemia who are greater than 65 years old and who are unfit for standard induction chemotherapy. The rationale for this combination is that demethylating agents such as decitabine or azacitidine are the standard treatments for patients who are unfit for conventional induction in this age group. And the observation has been that BCL2, which is the target of Venetoclax here, is commonly overexpressed in an important part of the anti-apoptotic processes going on in acute myeloid leukemia. So this study looked at the combination of decitabine or azacitidine with Venetoclax in 2 different doses of Venetoclax, either 400 milligrams or 800 milligrams, given daily after a ramp-up period. And patients were observed for overall response rates, including complete remission or complete remission with incomplete count recovery. We also looked at patients' overall survival and duration of response, along with safety outcomes and tolerability outcomes. What we're reporting here is that the overall response rate in this patient population of complete remissions or complete remissions with incomplete count recovery were 68% in 100 patients treated. The adverse events were typical of those seen in patients treated for acute myeloid leukemia, and most commonly were hematologic complications such as thrombocytopenia or neutropenia. Severe adverse events such as febrile neutropenia or sepsis resulting in hospital stays were reported in 20% or so of the patients treated on the therapy. But importantly, only 2 out of the 100 patients on study had a fatal adverse event within the first 30 days of treatment, which is an important endpoint for this group of patients. This clearly is a therapy that has not only the potential to achieve a complete remission, but the remissions seem to be durable. In a median follow-up period of 8 months currently, we have not reached our median relapse rate of 50%. So we are estimating our overall survival at 6 months of being 79% and overall survival at 1 year of being 70% in this current cohort of patients. We analyzed the endpoints of risks of treatment going in, including poor risk or intermediate risk cytogenetic groups, and we saw responses in both groups, with responses being slightly higher in the intermediate risk category. This will be taken to a phase 3 study, which is currently enrolling in the United States and worldwide, where we're going to be examining the combination of azacitidine and 400 milligrams of Venetoclax in this study, with primary endpoints looking at overall survival and progression-free survival.